it's one thing, the beginning, back to school is stressful enough for teachers and administrators, and now they are having to, some of them learn to teach a whole new way.
Yeah, and not only teach a whole new way, and they had some experiences with it last spring, but it was so new to everybody. I think we all kind of did the best we could, and that was okay, because it was a new environment for everybody to be at home or to be in these virtual scenarios. We spent a lot of time trying to figure out how to make sure we were doing the best we could early on. Then as we shifted to this idea that we'll have kids back, we started thinking what it was like before and what do we need to change to make sure that we have a safe environment for kids and staff. And we were marching towards that pretty well until the middle of July. And all of a sudden we see these surges or spikes. And again, we're shifting back to, okay, how do we revamp into this virtual environment? And again, make sure kids have good access, that teachers are equipped with the skills they need to create connections in a virtual environment, to make sure that the media that we're using is able to be delivered. And so it's just been that shift. And I think that, just like anything, the uncertainty for everybody is almost, it makes us tired as much as anything, is just the uncertainty of it all. So.
It's got to be wearing out teachers and principals and parents too. It's got to be, it seems like a mess.
And absolutely, our parents want to know, and we want to be able to tell them. And that goes back to when I said in June, we all, I think, really felt like we were heading towards an environment where nobody was going to be happy, because it wasn't going to be like a first day of school where parents are going to walk their kindergartner all the way into the classroom. We knew there was going to be some things that would change from our typical environment, but we also thought it would be more typical than not, in the sense we'd have kids in buildings. And for so many situations, we just haven't been able to develop a protocol in some of the communities where it is surging, to figure out how we can have kids socially distanced, or protocols with masks that would allow us to be safe and allow our staff to be safe. And I know that's frustrating for parents, because, it was frustrating for me as a parent with a college kid, trying to watch that virtual environment and what that means. And having taken her back to school this past weekend, wondering how long will that last, and how long before maybe even a college is back on a virtual platform. So I know parents are frustrated, and I sympathize with them.
So let's go to a couple of questions we have then, because that is the exact point a couple of pointed out to us. So here's one from the teacher perspective. This woman says that her daughter works for a private school in St. Louis. Her students, she says, will only be 3 feet apart in their classroom. She writes in that she thought it was supposed to be 6 feet. What should they do? Which is required? Is anything set in stone?
I would think one thing that we have found is there's not a whole lot set in stone. Most of what you see from the CDC, or even a lot of the pieces we put together as a team here in St. Louis, were recommendations. Now, there are some musts. You must, have opportunities for kids to wash their hands or to practice good social hygiene. You must maintain social distance when appropriate or when practical. Now, the thing that's changed probably that more you see some of the 3-foot guidance, is masks are almost universally being accepted as something that we're going to see in schools. So one thing I would want to make sure, any school, if they're bringing kids back, that we have some sort of protocols for masks. Again, age appropriate. Maybe it's not appropriate for our littlest of students, but age appropriate. Kids should be in masks right now. To me, the scientific knowledge right now says masks help reduce the spread. So regardless of whether you're 6-foot distance or 3-foot distance, a mask is an appropriate protocol for all students, private, public, home, wherever. That should be something they should be, utilizing as a mitigating practice.
That answers another question here, because she was saying, will a face shield be enough, or should she have students wear the mask? But I think you just answered that. You would say yes, it sounds like.
Yeah, I think a face shield, especially with some of the little ones, one of the things that's really important with that interaction with the teacher is that picking up of the body language and the social cues that a teacher provides for a student. And that makes this face shield a great opportunity potentially for a teacher. But again, right now with the situation the way it is, everybody really needs to be in a mask based on what I'm hearing from the experts.
Okay, I kind of got off track here. So let me because I've got a few and we've got a little bit of time. So I'll try to just run through these as quick as I can. But if something pops up and, we want to dive a little deeper, we really don't have, we can kind of do whatever we want here. Sorry, I just want to get, okay, there we go. Mark that one off. And, okay, there we go. Someone is asking, why is it okay for kids to go to daycare but not go to school?
Well, I think one of the things that daycares might have that a school wouldn't have the opportunity is because of the smaller numbers. Typically, you don't see a preschool classroom of 20 students or 30 students. They may have the ability then to socially distance and otherwise space children out in a way that could allow more so than what you'd find at a middle school or an elementary where we're putting, 25 kids in a classroom that really was never designed for social distancing. There is also a lot of scientists and folks that say really the younger you are, the less likely you are to contract or transmit that virus. So certainly younger students, we recognize that they would probably be the least likely at this point. That doesn't mean it doesn't happen. We've heard stories all around the nation where there have been children that have contracted it or unfortunately, really had serious illness from it. But again, it's not the typical like we'd see at the older grade level. So that might make it more appropriate at a daycare situation as opposed to a typical public school.
This person says, they wrote in and said, I'm a primary elementary teacher returning to school soon. What recommendations do you have when it comes to clothing or coverings in order to remain safe and healthy? That's from the teacher's perspective.
I think across the board, our schools have recognized teachers are going to need to wear masks, especially right now with the virus being transmitted pretty commonly. It seems like our number of our transmission rate's been high here in the St. Louis region. So certainly a mask for a teacher would be appropriate. Having opportunities for sanitizing the hands, still remaining socially distanced from the students, it would be important. And also the other big thing that we've recognized is for our teachers, limiting or reducing the number of contacts they would have with students. So by that, I mean, if it's an elementary teacher and they have, let's say 20 students in a classroom, making sure those are the only 20 students that teacher would come in contact with, or that those 20 students would come in contact. So you almost create a cohort of that classroom. And while it may make for a recess that wouldn't be as exciting as it was when you and I were a kid with our friends from the other teacher's class, it would give them an opportunity to do some of those, but minimize the potential of cross-contamination or the need to isolate a group of kids if they came in contact with another one.
What do you say to the idea of parents wanting to kind of do a cohort of sorts at home? The parents, we hear from them that they are just overwhelmed. First of all, they've got a job to maintain if they're lucky to be employed right now. And then now they're having to kind of, depending on the age of their students, supervise their virtual learning. What do you think about them teaming up with other parents?
Well, I think, generally when you think about our communities are strongest when we band together. When we recognize there's a situation in our community, whether it's something that we need to do physical labor to help our community, or in this case, banding together to make sure that we're providing a good, strong, supportive learning environment. Again, I would recommend that if parents were to decide to do something like that, a cooperative of maybe a few families that said, okay, we'll take the kids on Monday and Wednesday. You'll have them on, Tuesday and Thursday, and Friday's our virtual day or whatever. At that point, I would say, again, minimizing the cross connection. So if you did that with a family or two families and felt comfortable with that, then not introducing other children into that mix or other adults into that mix, but really making sure that you were adhering to the same things we try to do at school, create a cohort of students or children in this case and adults that we don't then intermix. We don't then send the children off to soccer practice where they mix with another 20 kids. And then, because that's where it really becomes troublesome to go back and contact trace if somebody does contract, COVID-19, then how do we go back and figure out what students would need to be monitored or possibly isolated because of it? So I would think that would be an important thing for parents to do. But again, banding together will make us all stronger.
Just while I'm kind of on the topic, I'm just thinking about, I have a sister who has a son, so I have a nephew. And he's going to be going in the first grade, and it's just kind of overwhelming, the responsibility, I know, to try to be responsible for your kids' learning, especially while you're trying to work. I'm sure you're hearing a lot of that from parents. Any advice to parents who are looking at this and kind of just wondering how long they might be at home with their kids, responsible for their education on a much more personal level than in normal times?
Yeah, and I can't imagine, because I remember what my little ones were like in in first grade. We know that it's more difficult at the younger the grades, the harder it is. I think one thing that I would say to parents that they need to remember, there's a lot of pieces that go along in school that aren't strictly learning from a book or from a teacher. There's other pieces of that school day that they need to make sure that they don't think that they have to engage your student for 7 hours a day, because while they're in a secure, safe environment where teachers are, guiding them through different things, they're not engaged in, a knowledge-based learning where I'm going to learn new information about. There's so many other pieces to school. And I think sometimes our parents get overwhelmed when they think I have to somehow come up with a 7-hour day to create an educational environment, because there's recess in there, there's PE in there, there's bathroom breaks in there, there's, getting to and from the bus, there's a lot of other pieces, there's electives of art, music, PE. So there's other things they could do at home that might provide them the break to be able to do some of the things they need. And I can't imagine what it would be like to have little ones, because mine are older now, but I know it'd be difficult. But I also don't think parents should put so much pressure on themselves to think they have to devise 5 school days of 7 hours a day, because that's when their kids are gone from them, and they assume I need to have, some sort of meaningful instructional practice. No, that's not it at all. They need to build in those times for some of that downtime that we would have otherwise, and take advantage of those times to give themselves some time, because I know it's difficult. And it's difficult for all of us social, emotionally. If you're a people person, interacting the way we are now is more difficult than what we'd have before. And we need to remember that, not schedule Zoom all day, so I think parents need to remember that too.
Yeah. That's a really good point. Kids have a little independent time that we forget about, a little time away from that. It's not all programmed all day.
Right. Well, I think as parents, we want the best for our kids. So we want to try and produce an environment that's going to allow them to be as successful and as, as smart, so to say, as they can be. But also we need to remember that's just like our own office job. We're not, just simply producing content for you all day long. There's in between times that you have to think or, compose your thoughts about stuff, so you're not always doing it. Just the same for kids. They won't respond well in an environment that was 7 hours a day of reading, math, writing in science. They need some of that other time to relax and be a kid.
Good point. Hadn't thought about it like that. Okay, I'm back to our list of questions here, and I'll maybe watch the clock too, probably. This one is a little specific, so I'll just read through it. If it doesn't make sense, let me know. But they say all 3 Muscuda schools have 1,000 kids or more. Can my child truly be safe if every child is going to school? Can they truly make sure everything is wiped down, the bathrooms are wiped down throughout the day? The bigger the school, maybe is a bigger concern for some parents if everybody is back. What do you think about that?
Yeah, and I can't speak specifically to Muscuda. I'm not familiar with their facilities, but certainly the more students you have, the more challenging it would be to create an environment where they would remain socially distant. Physical space for districts is difficult to configure in a way that would allow for, if we're going to use 6 feet, of personal space, that'd be difficult. And the larger the school, sometimes the more difficult that would be. With that said, there are some schools that obviously, because maybe of a declining enrollment, or because they have a number of students that have elected a virtual, would have the ability to create an environment that would allow for social distancing. Some schools have used an A-B day, where half the kids will be on an A day, half on a B day. And I've heard class sizes of maybe 8 or 10 for some teachers on their alternating days, because between the students that are going virtual, those that decide to go face-to-face on A-B, you may take a class of 25 and create 5 that are virtual full-time, 10 on A day, 10 on B day. We can certainly socially distance 10 students in a normal classroom. As for the cleaning procedures, I'll be honest, that was probably the easiest for schools coming up. We're pretty good at procedures. A lot of our schools run to the minute. We have bells that are, calculated to how many minutes. So for us, coming up with processes and procedures, oftentimes it's pretty easy. Establishing a protocol for cleaning, while we would have to implement and make sure that it was being, done with fidelity and follow up on that. I do think cleaning measures were probably one of the easiest for us to tackle as education leaders, to figure out how would we go about making sure high touch surfaces are clean, or, how do we maintain a clean schedule that's reliable?
Mm-hmm. Yeah, I think I can just speak personally. I feel like I can remember we were, as somebody put it, we were treating our mail like it was, from Chernobyl, and we have all kind of figured out this is the area and these are the things to clean that where our focus has to be. If a school returns full time and a teacher does not feel safe at school, does that teacher give up his or her job, or does the school district, are they required to keep their position until it would be safe for the teacher to return to the classroom? Have you seen anything on that? What can you say about that?
There's a lot of things there that could come into play. One, I believe every district that's part of our EdPlus footprint is offering some sort of virtual platform. So teachers are needed in those virtual platforms. So certainly if a teacher didn't feel comfortable coming back in a face-to-face scenario with students, I would expect that they would want to work with their particular district and say, what are my options for teaching virtually? That might be something where they could then have that opportunity to remain in a position and work with kids, but do so in a manner that wouldn't put their health at risk. If that wasn't a situation, there is some FMLA, and while I can't give legal advice, there is FMLA that is allowed, I believe, through the end of the year for workers that are individuals that would have health compromising conditions that would allow them to access that. In other words, they would continue to maintain their health insurance and be able to exercise that right under FMLA. But regardless, for that teacher, really, they should be working with their individual district, because there may be other policies or supports that are in place for that teacher to be able to utilize within their own district to help make sure they're not putting themselves at risk. I don't believe there's anybody that wants to put teachers at risk or kids at risk that are working in these scenarios. And we really are looking for ways to try and support not only our staff, but our students.
Can you talk about that a little bit? Because you do talk to the superintendents. And while, for those, who don't have a personal relationship with the superintendent of their child's school, it might seem like a little removed and a bureaucrat who's just making these heartless decisions. What are the conversations been like that you've had with the superintendents? Because I can only imagine they are pulled in so many different directions and those different directions make a lot of sense, and there are good arguments in all kinds of areas.
I will tell you without fail, our superintendents really do have big hearts. They have been wearing this pandemic on their sleeves. They're emotional, they're exhausted, because they do want to make the right choices. And I read something, and I'm going to paraphrase it a little bit, but we may never know as educators if we overreacted. But if we underreact, we're going to know. And I think that's that hard thing. For one of us to lose a staff or a child, or have somebody really become sick and have lifelong health consequences for decisions we make, it's a heavy, heavy burden. And I think they really do wear that and really do understand the decisions they make are very difficult, and they affect parents, because parents have things they are engaged in and need to do, and they want the best for their kids. It affects their staff, our staff's family. We live in a society where more and more we're seeing that interconnectedness of generations, where maybe, parents are living with their children, or children are living with parents, and then the kids. So we understand our community is awfully interconnected, and I just don't think anybody wants to underreact and end up in a situation where they're left to try to explain why they made a decision to do one thing or another. And it's kind of like a snow day. And I think I used the term one time, it's like a snow day on steroids. You know, we have to consider the road conditions, are our parking lots clean, and can our people get to work on a snow day? But there might be 1,000 factors right now for us to try to determine what's the best way for us to have school. And I think that's really the struggle for superintendents, because every time you think you have one figured out, there's another one that pops up and you go, wow, what do I do now? So it's complicated.
And it's not like parents want to just dump their kids off and have somebody else take over this stressful time. And they may have jobs that keep the lights on that they've got to get to, and all kinds of stresses on that end too, that I know the superintendents have to be weighing as well.
Yeah, and I think that's one of the things that I know a lot of our districts have begun to look at is how can they partner with people within their own district, but also other organizations within their district to try and provide additional supports for not only your parents, but staff. I know like City of St. Louis, Dr. Adams, they're looking at it, having some instructional support centers for people that need extra support for their kids to try and provide a supportive, structured environment, for those that need it. I know Pattonville, I think Dr. Pecoraro is working with some of their community organizations to try and provide some support in all of our districts. Those are just a couple that come to mind. All of our districts are doing that and trying to figure out how can we support, because we know our parents need to work. We all need to work. But then how do we do that in a way that's mindful of making sure we're taking care of kids and staff?
Well, you just answered the next question. I'll read it just to be sure, though. Is there any help for families with both parents working full-time and their elementary school-age children going full virtual, requiring one full-time working parent to be at home with their child instead? Where maybe another way of phrasing that would be, what advice would you give to parents to try to find some of those resources?
I think a lot of parents should start by looking at their district website. And I know that sounds like a kind of a general, but oftentimes those are updated on a regular basis with new information about programs or supports that might be available. Then if they're not finding something there, call the specific school that their child goes to. Reach out to that principal, or even if they know who their classroom teacher would be, even in a virtual environment, and ask there, are they aware of any supports or things? Because that could even within a school district vary from community to community. You have districts like Rockwood, Parkway, they're really large, and maybe there's supports in different areas of their districts that may be available, for somebody in a community locally that may not be at the other end of the district. So I think looking to their individual schools would be another really strong thing to look at. A lot of the faith-based organizations have tried to come up with some ways to support schools as well. So again, they might look to some of those community churches or other things in their region as well.
I'm guessing you probably don't want to speak specifically about Francis Howell either, but this is a Francis Howell employee, or well, they say FHSD. I guess there could be another district I'm not thinking of. Farmington High School. No, I know. I'm sure it's Francis Howell.
Uh-huh.
So this is an employee of a school district who is also the mother of one student. So she feels like she's a significant stakeholder in what's going on here. She says, our main question surrounds infection. How many students, faculty, and staff need to become infected in order for us to return to virtual instruction? How is our superintendent justifying going back to 5 days a week in light of upwardly trending confirmed cases? This person says there's some real fear in their home. I'm guessing there's not an exact number that any superintendent has to make a decision one way or another on. Do you know how they're making these decisions?
So one of the things we have been a little frustrated on, frustrated with, is the inability to identify the exact metrics that tell us this is when you go virtual, this is when you go back. But what we have started to do is really pull together some information, and it's going to be a variety of things, because no one metric will tell you, yes, you need to go back, or no, you can't. But we want to look at infection rate. And I will be honest, right now we haven't trended real well in the region. We're starting to go down a little bit now, but how many people per 1,000 are infected via a test? When they do the test, what's our positivity rate coming back? Is that 10%? Is it 15%? Is it below 5%? I know one of the thresholds we've looked at there is 5%. If you look at New York, they use a 3%. It seems like New York, right, wrong, or otherwise, they seem to have figured out some things. Their positivity rate for tests right now is around a 1. They're able to open up their schools. But they've said if they go over a 3 on the positivity rate, they'll go all virtual. I don't know that there's any community right now in our region that's below a 3 positivity rate. That doesn't mean they should or shouldn't open. It's just one of those things we look at. Another one is transmission rate. I know we're tracking transmission rate, and that's how many people, if I have the coronavirus, how many people will I spread it to? We always want that to be 1 or lower. Right now, it's been trending above 1. The higher it is above 1, the more likely we are to have community transmission. And I think schools, we feel as though we have an obligation as community members not to add to that transmission by bringing a bunch of people together. You know, that's the one thing. We haven't had kids in school since this pandemic started. You know, we kind of all came out of schools before we ever really, so we're a little anxious about that too. What does it look like? We've seen in some other states, we've heard the data. I think a lot of it gets politicized, whether it's right, wrong, or otherwise. But we don't know here in Missouri what it's going to look like because we really haven't had kids in school at a large level like we're getting ready to in some of our counties. So we don't know. But positivity, transmission rate, and then we also, you know, there's some other metrics we're looking at. We work with the physicians from WashU and SLU, as well as a pediatrician, and then the health directors from each of the county. And we've participated in a working group on Thursday morning that really are looking at what are our metrics and what should we be considering as we try to make those decisions.
You know, it's so funny that seems so long ago. I had forgotten that it was really mostly preemptive. I mean, we were freaked out when the father and daughter went to the dance and started closing things down. Then really, and not long after that, everybody was closed down. And that was when one case was a big deal. And now we have hundreds a day.
Yeah, exactly. And I mean, wouldn't we all just love to only have to worry about one father and daughter that maybe broke quarantine? I mean, right now it's, you know, it really is, you hate to say it, but we've kind of become numb to where we were when we started to where we are now. And again, I think we can do some things, and I know everybody wants to get kids back. We just want to be real careful that, again, we're making the best choices we can not to put somebody at risk.
Okay, let's see. Will colleges welcoming kids on campus have access to rapid results testing to test students before they can move into the dorms? That's a little bit maybe out of your expertise. Curious if you have thoughts on that.
It is out of our expertise. We really don't work with colleges or universities. I will tell you, as a dad that took a daughter back to Missouri State last weekend, and she's living off campus and she's a senior. So I hope at this point she'd make good decisions. But yeah, it's a little anxious for a dad to, you know, take a kid back to a college campus and not knowing how that interaction and mix, because Missouri State, they're going to have kids from all over our state and all over the country coming back. And what's that really mean? I don't know. We're crossing our fingers, but yeah, mom and dad are a little anxious, and mom's a school teacher and heading back too, so she's a little anxious as well. So the Ziegler household is a little out of sorts these last couple of days.
This isn't just academic for you and your organization. I mean, you're living it too, it sounds like.
We are. And, you know, and I really look, so many of the folks that are really dealing with it on a school district basis, these are my colleagues, they're my friends, they're the folks that I've come through the ranks with, and I see it wearing on them. And I know we all have jobs that we do and it all affects us differently, but this has been probably the most difficult time that I've ever seen in education. And we've had other tragedies. You know, you think of Parkland, and I think the way we came together as an educational community after that. You think about what happened with the Michael Brown situation, the way we came together. So we've had other situations that have forced us to work together and come around, but I've never experienced something like this. It's just, I think not only the importance of the decisions we're making, but the length of time we've spent trying to figure this out. It's exhausting.
Well, and the length of time we will be potentially living with these kind of emergency measures. It's the one area, it seems like, that affects the most people with this virus. Obviously, there are the most severe effects of this when you think about people's health or even the loss of work, but this affects the the vast majority of everyone in our community, whether you're a parent or not, there's a ripple effect here where these decisions are affecting everyone.
Absolutely. And that's, I think, the thing that we recognize, because really, I think if anything, it's really brought into focus the idea of schools and what we are to a community. I mean, for a lot of our kids, we're the 2 meals a day, we're a safe, secure environment, we're a social, emotional health provider, we're a physical health provider. And we're doing that along with trying to create an environment where they can learn things that are going to make them a productive citizen. But when you think about all those pieces that we really bring together in a school, it's really multifaceted. And I do think as we continue to talk about schools reopening, we have recognized all the pieces and components. We are the daycare for our parents. It's more than daycare, obviously, but that when you boil it down, they know their kids are in a safe, secure environment. You know, you look at all those pieces and you plug them in, and it really is a complex organization when you think about schools. And I think, unfortunately, the shutting down of schools has forced us all to realize all those pieces. For a while, we were really worried, how are we going to feed kids? There were weeks that we were feeding over 300,000 meals out of St. Louis County alone a week to children. And, you know, that seems like it was forever ago, but that's continued to happen all summer long. It becomes so, you know, after we figured out how to do it, it's just another thing that schools do, and it's kind of expected. And that's good. We like to be that entity, that resource, that, you know, body. But it takes an army of people to make 300,000 meals and deliver them to kids. And like I said, that's been going on since March, and it hasn't stopped. So
that's incredible. That's incredible. I feel like a lot of things, I can only imagine we will have a different, I guess we could only hope that we'll have a different, at the very least, more informed perspective on the value of our teachers in schools.
Yes, I hope so too.
What about school bus drivers? This person says, we transport the kids to school. Are we thought about as well? And we see kids before the teachers do. When, you know, what is that a factor that the superintendents are having to think about?
Yes, a lot of things. One, I'll be honest, when we started doing some calculations early on about how could we socially distance on a bus, thinking if we were going to create a 6-foot area that a student, you know, it would take a 60-passenger bus and make it an 11-passenger bus. So when you start calculating that out, especially with some of our big kind of rural or even, you know, just more expansive districts, there's not enough buses in Missouri to transport kids in a reasonable manner to get them to school. So then we had to realize, okay, what type of things could we do to try and reduce what that exposure would look like? And this includes bus drivers. So we started thinking, okay, what if we left the seats by the bus driver empty? That way they wouldn't have a kid sitting behind them. That's one way. You know, making sure we have sanitizer on all the bus, that's another way. The way we load buses. So the first people we'd pick up, we would load towards the rear of the bus and then load towards the front after that, minimizing the cross-contamination amongst the kids. And then as you would leave, the front ones on the front of the bus would get off first and so on. Making sure that when we did AB days, if that was the case for a hybrid schedule, that our families were the ones that were considered in the AB days. So do it alphabetically so that all of the Smiths rode the same bus to school. Again, they would more than likely be around each other at home. Being around each other on the bus would limit that, you know, kind of that exposure. And then for our bus drivers themselves, making sure they have masks and the ability to wear those masks and the other precautions, but giving them some social distance space as well.
So many things to consider. You just kind of touched on this. It says, how are they going to provide lunches for students? But it sounds like that will continue. If I guess this person is assuming if they have to be virtual, will there be lunch programs still?
Yes, so all of our districts had figured out ways to make deliveries available for students. Both, some have done it actually going out and delivering into the community. Others have done that through pickup spots. There's a variety. Some have done 2 or 3 days a week. Some have done every day. Some have done once a week and provided meals for the entire week. One thing I will really say that our our community, meaning the whole St. Louis region, has done well. I don't think I heard of any situation where a kid was turned away from a meal over this situation. By that I mean there was nobody checking IDs and going, oh, you know, Paul, you're really supposed to get your meals over in Hazelwood. You're in Pattonville, so we're not going to feed you. No, it was really all hands on deck to make sure kids had the meals they needed. And if a parent pulled up and said, I have 4 kids, we didn't say, well, we need proof. It was, here's meals for 4. And I really think that was something that really early on was established as kind of, this is our routine practice in the region. And it doesn't matter if they're at grandma's or if they're at, you know, with mom and dad, we're going to feed the kids. And I think that would remain, whether we're in a virtual environment or, you know, for a week, a month, or you know, the first semester. I think we'll take care of the kids that way.
Good information. I'm an elementary school teacher, and I was wondering if I should plan on changing clothes and shoes before entering my house at the end of a school day. Do you think it could go that extreme?
You know, I would probably defer that to maybe somebody that has more scientific basis. Right now, I'm not doing that personally if I go out to a store or go out and interact in a situation. But certainly if that made somebody comfortable or made them feel as though that gave them an extra precautionary step, certainly that's something they could do. I don't know that the science out there says you should or shouldn't, so I'd probably defer to that. But again, if that's something that makes somebody feel better about their situation or where they're at, I certainly would do it.
This kind of, you've touched on this, but this person is just worried about books. Should they be left alone for 72 hours to make sure the virus is dead? I'm guessing cleaning protocols go to everything in the classroom. And you said that's something you guys have been thinking about as a region.
Yeah, so I think, again, I don't want to come off as nonchalant, but I think cleaning procedures are something our schools can do very well. I think we have, you know, practiced some of this during our flu seasons. We've all heard of different school districts where the flu kind of would run. So we all have had protocols in place that would allow us to really do not only deep cleaning, but regular cleaning of high touch areas. And I think just making sure those protocols are followed and maybe accelerated a little bit, I think that part's easy. As far as books, I mean, certainly I would think, you know, as books come back, you'd wipe off the covers or those hard surfaces. I don't think it doesn't seem to me that we've had near the panic or urgency around contacting paper. I know originally we all thought, well, we better not, you know, touch the mail, or we better not open that Amazon package in the house. I haven't heard of that as much as being a transporter of the virus as much as some of the other, you know, hard surfaces. So again, I don't know for sure that what exact protocol somebody would use for books outside of wiping the covers. But again, I think schools will have the well in hand.
Why are plans in the region so different from one another, even among districts located in similar communities serving similar demographics?
So I think there's a lot of different things. Resources is one. Obviously, and by that I mean facility resources. I know that there are some schools that, because they've had a declining enrollment, really because of the space they have, could practice social distancing in a much more readily, could more readily do that because they have the space. If you're in a growing district where you're trying to keep up by building schools as quick as it'd be very difficult to create that. So that might be one piece that would go to a difference between school districts. Another piece would be, how is the virus affecting their specific population? We've had the ability to go down to zip code level and actually see where the virus is maybe hitting some communities more harder than others. And when that happens, we need to be able to, as being part of the community, a school district, we need to be able to respond to that. So I know in Wentzville, they've seen some surges of some cases out there that may have caused Wentzville to respond differently than maybe St. Charles City School District. There's, you know, both in St. Charles County, maybe serve similar populations, but again, are experiencing different things in their community.
A couple of these questions kind of go together. One person says, are districts partnering with federal, state, and local leaders and organizations to meet urgent needs such as reliable access to internet, tech, resources and training, nutritional meals, child supervision, mental health, and more? I mean, so I guess the question there is, do you see schools getting any help or reaching out for help to state and federal partners?
There's a couple different things that have happened there. We'll start on a local level. I believe every county now has made some funds accessible to school districts to help offset some of the costs they would have associated that they wouldn't have had we not had the virus present. Beyond that, then Dr. Page recently announced that he was going to set aside $4 million to purchase Chromebooks and hotspots to make sure students in St. Louis County have the ability to access that. In Jefferson County, Dennis Gannon, who's their county administrator, I know has made CARES funds available to their school districts to offset some of those costs. So how each of those districts use that may be different. If you're a district that already had a one-to-one computer initiative, buying another Chromebook may not make sense, but buying a hotspot might. If you're in some parts of the county where Wi-Fi accessibility is really strong because so many businesses and communities have it, it might not be a hotspot. Maybe it's some other thing that you would do with those CARES Act dollars. But each of the communities have made those funds available to schools to varying degrees. So that's certainly possible. I know SEMA and FEMA have provided some additional support for additional masks. I know I've been recently contacted to get a delivery of masks for St. Louis and St. Charles County. Jefferson County has some coming there too that'll be provided by state and federal emergency dollars. So there's a lot of that. It may be utilized a little different in every community, but the access is there in different capacities.
And this kind of follow-up, this person says, I wanted to know if there is help with virtual learning for a person who has 4 elementary students and a mom who works outside the home in healthcare, and then a 65-year-old mom who is watching her kids, the grandmother, it sounds like. That goes back to some things we've talked about, but it can be a lot to even find those resources, it seems like, for parents. Your advice on how to get some tech help.
Yeah, so one of the things that's been probably good about having the summer here is all of our school districts have a certain amount of tech support. And I know they've worked really hard to make sure that they're trying to make that virtual access as seamless as possible. When we rolled it out in March, we had all kind of talked about what it would look like to offer virtual courses, more associated with like a snow day. If we had computers in kids' hands, could we have school on a snow day? Never had really thought about it for a long period of time. Because of that, though, over the summer, I know a lot of the districts have really spent a lot of time not only looking at what type of learning management system could I use to make this easier to interface for students and parents, but then also how can I make maybe a single sign-on. That sounds, but we're all sick of passwords and sign-ons for all the different things that we have, but making sure that when kids access that, maybe it's a single, one sign-on. So those type of things will help. Certainly if you have that situation where you have, 4 students and maybe a grandparent or somebody that's maybe not as tech savvy, reaching out to that school again. Every school is going to have the opportunity to try to support parents, whether that's through a helpline or through, maybe getting on a call with somebody to, visit with them and talk them through what it would look like. So I think there will be supports there.
This is a question that we could have asked even before the pandemic, and it applies to every question that we are talking about in the pandemic. But this person just simply said, what is being done to ensure educational equity for all students in St. Louis? Do you feel like as a region we're doing enough, at least in this moment, to make sure nobody gets left behind here while we're trying to figure this out?
I don't know that we'll ever have done enough until every kid has the ability to access the resources they need to be successful. And I know we don't have that situation right now in St. Louis, in St. Charles, in Jefferson, and any of the counties. Have we done a lot to try to make sure? Absolutely. We have looked at how could we get hotspots in the families' hands to make sure they have access where they didn't before, to make sure we're providing other supports, both social emotional supports as well as food supports and other things to make sure. But we have a long way to go to make sure that equity is across the board. But have we kept an equity lens on almost all the work we're doing? Yes. We realize that what we need in one community may be vastly different than what we need in another community. And sometimes they're not equal. Sometimes we have to give a little bit more in one scenario to make sure kids have access than we did in another scenario, because maybe they already had that ability. You know, if every house in your community has reliable internet, we don't need to send hotspots to you. And, you know, so, but we may need to in another community. And I know that is a lens that all of our educational leaders have used.
Here's a very specific one I think that was important to address, IEPs. What are you going to do about all the kids that have individualized education programs and require hours of intensive one-on-one therapy each day that can just not be done virtually? What's the latest there?
And it's going to vary, obviously, depending upon the student. And that's why I'm a formal special educator, and every student has specific needs, and the ability to meet those needs will be for each school district to work with that family to make sure. So if it's a student in St. Louis County, they're going to work with St. Louis Special School District to make sure that the goals and the objectives of that student's IEP are still appropriate. And then how can we deliver that in a way that's meaningful for that child to be able to access, you know, a appropriate education. In Jefferson or St. Charles County or Warren or Lincoln counties, they have their own special education departments within the school. So in those cases, parents would work individually with their school district. Every one of the students should have a case manager, is a term that they might be familiar with. That's their student that, or their teacher that is kind of that liaison for the student to the school. And they should contact that teacher to make sure what type of things are we putting in place. There may be some different provisions for students with IEPs than what we'd see in the rest of the population. There may have to be some interaction that is face-to-face or in not a virtual environment to make sure their needs are met.
Thank you. That's good to know. Almost done here. I'm just trying to sip. Some of these are a little competitive.
I was gonna say it's not that bad. I've only had like 6 calls since I've been on here. I'm thinking,
no, me too. Well, apparently,
it's gonna take me the rest of the night.
Apparently, the breaking news 31 minutes ago. But we have been talking a long time. I'll get you off your.
Oh, not a problem.
But Biden has picked Kamala Harris apparently.
Oh.
Yeah. So
well, which is a bigger story today, that or the Big Ten? You know, right. We're going to find out which is really important for the United States now.
Trust me, more people will click on the Big Ten. I'll just tell you that right now. If a puppy gets hurt, and I'm a dog lover, but if a puppy gets hurt, they'll click on that more than they'll click on the child that gets hurt. But anyway, that's a topic for another time. Let's see. Here's a good specific question. So this person says, I have kids in different grades. If a student in a class is exposed to COVID-19 and then the whole class has to stay home for 14 days, do I need to keep my other child home as well? Will our entire family be required to quarantine for 14 days? A lot of variables there when you've got more than one kid going to class, going to a school. Has there anything been worked out that you've seen?
There is. So a couple things there. Each health department is going to work with families when they think there's an exposure or school district. So starting with that kind of as a basic. Dr. Rachel Orscheln, I don't know if you're familiar. She's done a few things during this pandemic that has, you know, been out on the media. But Dr. Orscheln has developed kind of a contact tracing algorithm that kind of says, okay, if here's a child that has exposure, here's where we're going to look to make determinations about who else was a close contact. It's all going to come back to who was in close contact with that child. Both were they exposed, but then who else did they expose? My gut tells me that in most of our family situations, if one member of the family has been exposed to the virus, chances are the rest of the family is going to be considered a close contact. Now, obviously, there could be variables to that if, you know, maybe it was a split household and some kids were in one, you know, staying with dad or mom and the other. You could have some variables where maybe that wouldn't be present, but more than likely in a family situation all under one roof, I would imagine the majority of the time they would be a close contact and probably asked to quarantine or isolate by that health department if they thought there was a strong likelihood of exposure. If people go that algorithm that she developed, there's some links out there. It's through WashU, and it really kind of lays it out real nicely on what St. Louis County Health would be looking to and how that would work within that contact tracing. I don't know that all counties have adopted that, but I know they will use something very similar to that to kind of make those determinations.
Okay. Okay. Yeah, this person just says, so many school-age children live with grandparents, and they're wanting to know how safe is it for them if they've got the kids going to school and then the older grandparents who may be compromised with their health at home. That's just another factor I'm sure that school districts are thinking about when they're deciding whether to bring the kids back. Do you have any advice for families in that situation?
No, it's difficult. I mean, obviously, if students are not in a virtual environment and they are back at school, certainly creating some social distance between grandma and grandpa or elderly people within your household and those children is probably best practice. Maybe wearing masks, as odd as that would seem like all of us to do at home, that may be a consideration you'd want to make. Maybe having grandpa and grandma have certain parts of the house that they utilize and the rest of the family somewhere else. Unfortunately, there's not a good answer there that keeps what we see as that traditional family unit intact and also minimizes that close contact. I wish there was a better idea there, but I just think you would really have to take it on a case-by-case basis and see if you couldn't create some scenarios that would create that distance among them, or practice those protocols that would really lessen the likelihood of spread if somebody were to come in contact.
Yeah, just one of so many scenarios that there are no easy answers for. I think we can leave it there. This kind of was answered, again, without getting into specific schools. You kind of talked about the differences that individual districts may be considering, even if they're kind of geographically close. But this person specifically wanted to know why might Confluence Academy be doing face-to-face, not going online, when SLPS, KIP, Lift for Life are all going virtual. Do you have any insight to that?
A couple things. One, obviously, each district, or in this case, schools or charter school, have a little different scenario under which, how many students do they have? What does their space look like? Certainly building size and other things. Now, I do know Confluence Academy is virtual for the first quarter. So that may have changed since the question was submitted, but I know they are following that same lead as St. Louis Public, and they are going to be virtual for the first quarter. But again, just generally, when you look at it, every district has a little different set of circumstances, facts, and other that may lend them to be able to do something a district next to them might not be able to do.
I guess the takeaway for me after talking with you is that there are just a lot of variables, a lot of unknowns, not that many straightforward, yes or no answers. And then also a lot of work that parents still have to do, whether their kids are going back to school or staying virtual, to make sure they're getting questions answered they have from districts, getting resource they need from tech support to meals. It sounds like a lot of unknowns still, and a lot of work for parents to do still.
It is. And, I think the thing I hope parents know is school districts really do want to be partners on this. We realize it is not, I said this to our superintendents when we worked together. It'd be a lot easier for all of us just to bring kids back and act like none of this was happening. We're pretty good. While there's always a few hiccups on that first day of school, we're pretty good at opening schools. A lot of my colleagues have done it 20, 25, 30 times in their career. So we get that. This is hard. But also, I hope, knowing that we know it's hard on our parents, but we want to be their partner. So if they have those challenges, we won't make everybody happy with any decision we make. If we go virtual, there's going to be parents unhappy, and there's going to be some that are happy that everybody's doing. If we don't go virtual, there's going to be some that are unhappy, and some, we know that. But what we want to do, regardless of whether you're happy or unhappy with us, is make sure that we're your partner. So if there's something that you think we can help you with, reach out to us. Give us an opportunity to look for a solution that works for you. It's not going to be ideal. There's nothing about this pandemic that's ideal, and we know that. But there are things that we could do to lessen the burden, whether it's on a parent, a grandparent, a sibling, something that we might be able to come up with, but they just need to communicate with their schools and reach out. And understand also that as many people we need to communicate with. They may call today and they may not get a call back till tomorrow or the next day. We're not always able, with the volume of communication that needs to take place, to reach out to everybody right away as we try to work through this, but they will call and they do want to work with our